Hello everyone, welcome to another lecture on appendix. So first of all, let's see the location. The location of the appendix. It is located at the base of the cecum, and it may be up to 10 centimeter long, and it usually differs from 2 to 20 centimeter. That means appendix may 2 centimeter long or maybe 20 centimeter long, and on average it is 10 centimeter long, and it is mainly lymphoid tissue. Hence, it is mesenteric adenitis may mimic appendicitis. That means the many patients suffering from mesenteric adenitis may be misdiagnosed as appendicitis. And tinea cecal tinea coli converts at the base of the appendix and form a longitudinal muscle cover over the appendix. That means during operation, when we find the appendix, it usually located at the convergence point of the tinea coli. There are three tinea coli, and these three tinea coli they converge at the base of the cecum, as well as at the same time at the base of the appendix. So to find out the appendix, we have to find out the convergence point of the tinea coli. So here we can see this is the appendix. Here this is a worm-like structure which is vermiform appendix, and this is the tip of the appendix, and here this is the base of the appendix. And we can see the base of the appendix, it arises from this three convergence point which is the tinea coli. So the vermiform appendix, its base is located at the convergence or meeting point of the three important tinea coli. Here we can see this is the ascending colon, here this is the cecum, and this point is the vermiform appendix, and it is located at this junction of the three tinea. Then the applied anatomy, the convergence should facilitate its identification at surgery, and it is retrocecal, and if it is retrocecal and difficult to find. So during the appendicectomy procedure, to find out the appendix, we have to see the tinea coli, and this tinea coli convergence at the base of the appendix. And the appendix, it is intraperitoneal structure, and it is located within the mesoappendix. And the appendix is supplied by the appendicular artery, which is branched from the ileocholic artery. Here we can see the blood supply of the appendix. This is the appendix, and it receives blood supply from this artery, which is the appendicular artery. So the appendicular artery, it supplies the appendix. And here if we go back, and again here is the important structure which is the mesoappendix. Here we can see this is the mesoappendix, and this mesoappendix is attaches to the appendix. Yeah, this is the terminal ileum, and here this is the cecum. And if we go back, we can see the appendicular artery, it arises from this artery, and this artery is the ileocholic artery. So appendicular artery, it arises from the ileocholic artery. And in this picture also, here we can see this is the ascending colon, here cecum, here this is the terminal ileum, and here we can see the blood supply of the appendix, the appendicular vessels, and which finally the appendicular artery branches from ileocholic artery, and the appendicular vein, it drains into ileocholic vein. So these two important name we have to remember, that appendicular artery and appendicular vein, and also the ileocholic artery and ileocholic. Another important topic, which is the McBurney point. Here we can see the McBurney point. It is 1/3 of way along a line drawn from the anterosuperior iliac spine to the umbilicus. So first of all, we have to draw a line from the anterosuperior iliac spine and from the umbilicus, and 1/3 lateral and 2/3 medial point is the McBurney point, and the appendicular fin usually filled at the McBurney point. So here we can see this is the McBurney point. It is junction of a line which connect anterosuperior iliac spine and umbilicus, and at the junction of the lateral 1/3 and medial 2/3, this point is the McBurney point. And the appendicular pain during appendicitis, the pain usually settle at the point of the McBurney point. Here you can see this is the McBurney point. Now here in this figure, it also shown here, this is the anterosuprailiac spine, and here this is the umbilicus, and McBurney point, it is located the lateral 1/3 and medial 2/3 of the line. And here we can see the incision point for appendicectomy operation, and it is perpendicular to this line, that means a 90° to this line. Now the different position of the appendix are located in the different position. First of all, here we can see the retrocecal, which is the maximum portion, and it is 74%. So during the different position of the appendix, the most important position is the retrocecal, that means the behind the cecum. So retrocecal position is the most available position of the appendix. Then pelvic, it is 21%. So retrocecal and pelvic, it is the most common among them. Retrocecal is 74% and pelvic is 21%. Then some other positions such as the post-ilial, subcecal, paracecal, and periilial. So these are the normal position of the appendix. Here we can see the different position. First of all, identification. Here this is the ascending colon, here the cecum, and this is the terminal ileum, and they are showing the appendix in different position. Here this is the retrocecal position, which is the most common variety. Then the pelvic variety is second most common. Then other positions such as here the subcecal, periilial, and post-ilial. So these are the common location of the appendix. This is the another figure showing the different position. First of all, this is the retrocecal, which lies behind the cecum. Then we can see pelvic variety 21%. Then subcecal, paracecal, and periilial and post-ilial. So through this figure, it will be very easy for you to remember the different position of the appendix. And nerve supply, the sympathetic and parasympathetic nerve supply. The sympathetic nerve, it is derived from the thoracic 9 to and thoracic 10 segment through the celiac plexus, and parasympathetic, it is derived from the vagus nerve. So these two important points also very uh, important to remember, that the sympathetic nerve arising from the thoracic 9 and thoracic 10, and parasympathetic, it is derived from the vagus nerve. And refer point of the appendix is usually felt at the umbilicus, because this is similar to that of the small intestine and testis, because the umbilicus, it gets the innervation through the thoracic 10 segment. So usually the first pain felt in the umbilicus, then it settled down in the right iliac portion. Here we can see the symptoms of abdominal right left quadrant, nausea and vomiting and fever, and it usually first felt around the umbilicus, then finally settled into right iliac portion. So this is all about the appendix. Thank you all.